So is medical device knowledge and work experience is going to help you to get a PM role? In what way, if yes? What about not?
Yeah, so here's, I'd say it depends. Yes. So I was at Verily before. I think you can know from public experience that Verily's been involved in some hardware plays and some software plays. And so we had product managers with backgrounds in both. And I would say I would never hire me to run a medical device program because that's not what I do, right? I'm pretty darn good at shipping software, at shipping complex software operational things. But I would not be a person who could, most efficiently run a medical device project. So we staffed our product management teams based on people with those backgrounds, and they were good at it. And there's a huge skill set there when it comes down to thinking about how do we not just design something that's safe and effective and novel and all of that interesting stuff, but then how do we think about how do we build it? How do we make it, work at a factory? How do we ship this thing and so on? So there's a deep skill set there. But I'd say if that's what you're really good at, you'll probably want to look at med tech startup type companies or companies that have that need. And it's not to say that you can't take that background and move into software product management. You certainly can, especially if you've got a deep enough engineering background. I'd say as a product manager, I should have said this way back. I've been involved in recruiting for Google for a long while, from MBA programs and from elsewhere. Interviewed a number of people, and I've hired a number of product managers who did not have computer science backgrounds, did not have engineering backgrounds. Now it's the exception, but it happens. And so we're looking for the skill set, not, a list of things that if you don't have them, you're out. And the thing that we're looking for is really, that combination of you've shipped, how to make the right decisions, and you're credible with the engineering teams. And you don't have to have that, computer science background to be credible with the software engineering team. So medical tech background folks are often, in my experience, extremely credible with engineering teams, know how to speak their language, think in, the ways that they need to think to make that transition. So that's certainly possible. I'd say the downside is, in my experience, med tech companies also do some of this upstream, downstream split thing. So part of it is if you're going to move into a, more tech startup kind of product management role, just think about what the expectations of that role are versus what you're taking with you or have experienced in med tech companies.